So the role of the caregiver is very, very crucial in Huntington's disease. So the caregiver uh, can be a parent, can be a spouse, or can be a son or daughter, or a sibling. So in all of these things, see, when the person who is the caregiver is at risk himself, so it's when it's a child or it's a sibling, they would have already seen some family member who's gone through it, so they know sort of what this disease means and what is likely going to happen to this patient, so they're sort of mentally prepared. When it is a spouse who has no idea of what this disease is, sometimes it becomes more difficult to manage. Now, nobody actually dies of Huntington's disease itself. The disease causes problems in movement, causes problem in swallowing, communication. People fall very often, and then because there is swallowing problem, there is a tendency to for the food to go into the food pipe, because of which there are complications of pneumonia, etc. Falls lead to fractures, and then the person becomes bedbound. So a lot of it is patient management, in the sense that if you provide your patient a good atmosphere, first of all, a positive atmosphere at home, that this is not a terrible thing that has happened, we can deal with it. Second thing is the nutrition. Now, most of us, we would like to take 1 gram protein per body weight, let's say. For a HD patient, because there is so much of continuous movement, it's very important that a high calorific diet, high protein diet is important. So, like almost 1.5 grams per body weight would be good. And then also a very rich diet of carbohydrate and fat. The reason being that because so much of energy is constantly being expended, because their hands and legs are constantly moving, and that expends a lot of energy. So what you would say is probably unhealthy for a middle-aged adult is very good for an HD patient. What is crucial is that because they have problems swallowing, often they may eat a little bit and then they start coughing and they get frustrated and say, okay, I'm done, I don't want to eat anymore. So they have to be given food in the right kind of consistency which they are able to handle. So most patients find it difficult to drink milk, like something which is very liquid. But something which is a semi solid porridge or ganji consistency is easier to handle. So, whatever works for the patient is what should be given. And secondly, the patient should focus on eating while eating, not be watching TV and trying to eat at the same time, because this is a concerted activity which requires attention for a patient, and therefore there's a chance of choking and things like that. Never try to drink water from the top like that. Use a straw, or just sip. So these are small things which prevent more serious complications, because if your food goes into the food pipe, then there are complications of choking and pneumonia and all of that, which we want to avoid. Another thing is, because of these movements, they tend to fall, or they tend to hit their head on furniture. So a lot of patients use a helmet even within the house, even when they're not driving or anything like that, so that even if there is a fall, there is no cut or no abrasion on the face. So that is something which is available and is used. So that is one thing. So basically, if you try to prevent falls, control nutrition, maintain a good diet, and try to maintain a positive atmosphere, you can keep going for a long time. People have maintained their jobs and kept working and been functioning up to 60 and more. So it's not like, okay, I have to pack up now, I have this and I can't do anything more. So that is not an attitude that should be encouraged.